Hello, this is a video blog regarding the healthcare system in Australia. It's a matter of disclosure. It gives me no pleasure whatsoever to be making this video, but I just thought that it was important to let ordinary Australians know that if they're expecting any kind of financial alleviation from being a member of a private healthcare fund, that it's a good chance that if the eventuality ever occurs that they need to go to hospital for medical treatment, that they will be gravely disappointed. The reason being is that your healthcare insurance only covers you for your hospital stay, and the price for your surgeon and anaesthetist and pathology fees all come on top of that. They're independent of your stay. Now, where the problem really sets in is that every single operation that can possibly be conceived of is ascribed an item number. That item number is set by the Department of Health. Now that particular fee for any particular operation is either grossly inadequate or the medical profession are grossly overcharging, one or the other. Either ways, you get what is quaintly referred to as out-of-pocket invoices sent out to you in the post. So you thought you were covered, but you weren't. And what happens is the grossly inadequate amount of money that was attributed to that particular operation, Medicare picks up 75%, and your healthcare fund, which you've been paying into for years and years and years and years and years and thought was going to give you some financial alleviation in the eventuality that you may end up in hospital, picks up 25%. That sounds insane to me when you think that your medical and private healthcare insurance is probably twice what your home insurance would be per year. Obviously, if you're in hospital for a long period of time, at least it will cover you for your stay. But what happens when you come out and you've had a serious operation and the surgeon's bill is $18,000 and the Australian edit number as prescribed by the Department of Healthcare is, let's say, $7,500, you're in big trouble. And there's no point in ringing up your healthcare company and having a go at them, because the system is in place. They pick up 25% of the prescribed edit number as prescribed by the Department of Health. I have a feeling that most Australians don't know this. I have a feeling that most Australians go to bed at night thinking that if they're paying their private healthcare insurance that they are covered at once they've paid and any excess fee that they have for a hospital stay. I just want to let everybody know that you're not covered, that you will have to pay your surgeons, anaesthetists and pathology and possibly other bills on top of that, and that they may be far in excess of the prescribed edit number as prescribed by the Department of Health. So, as I say, it gives me no pleasure whatsoever to make this video, but it's a matter of disclosure. And I would rather people weren't deluding themselves about thinking that they were covered when they're not, especially if they're a young family or anybody who wouldn't have a large excess of money in the eventuality that they end up in hospital to cover their medical costs. So we'll see how this video goes down. Does it resonate with people? Do people want to respond to it and put up a video post of their circumstances? Because I suspect this is endemic. And perhaps if I get a response, I'll do another video and script the next one and try and be a bit more specific and cover a few more angles of this situation. As I say, maybe the whole thing's my fault. Maybe we just didn't know and were at fault. But as I say, it's a matter of disclosure, and I think that most Australians are not aware that they will be charged extra fees from surgeons, anaesthetists, pathology and everybody else, and then that figure may be in vast excess of what they're entitled to claim back, which Medicare picks up 75% of that tab anyway. Your health insurance fund will only pick up 25%. That's all for now. We'll see how this goes, and maybe we'll do another one at a later stage. Thank you and good luck.